My name is Dr. Javier Campos. I am the Executive Medical Director of Perioperative Services at the University of Iowa Hospitals and Clinics. Welcome you to the expansion of the 4 new operating rooms. So what I like to do is to give you a tour and explain to you and introduce you to the newest technology that we have and design for operating rooms, which at this point will help tremendously with the surgical volume that we have, because every day we experience a very large increase of volume, and this will accommodate pretty much and expedite all the patients that require our services in the operating rooms. So at this point, let me show you, this is a very large room. This is room number 30. And what you see now is the size of the room. This is about 750 square feet, which is considered a very large room. So we built 4 operating rooms, or they have the same identical size. All have integrated technology. As you can see through the demonstration here, we have very large monitors, so that enhances patient safety. In addition to that, we have integration technology that allows our surgeons to pretty much display all the surgical procedure to very large monitors that they are distributed through the room. So let me show you, for example, what we have now that perhaps will facilitate our surgeries. This is an integration technology for minimal invasive surgery, for example, laparoscopic surgery or arthroscopic surgery. This area here, I'm going to show you the anesthesia machine used by our anesthesia team, anesthesia providers, anesthesiologists, CRNAs, residents, and fellows. And as we can see here, we have also what we consider a state-of-the-art technology in terms to provide what we consider the best practice for our patients. Now, when you look here, if you look at the design of these lights, basically this light here has an integrated camera that allows, because we are an academic center, and that allows the surgeon to share pretty much the surgical field if we have residents or fellows who are observing the surgical procedure. So they will look this camera here into the monitors and allow them to display pretty much the operation that is taking place. Or if the surgeon is doing microscopic surgery, we can connect the microscope into these monitors and they will display and enhance the view of the operation. Also, we have refrigerators that allow us to storage blood or any solution that requires a special temperature. And this is an integrated technology that allows us to set up the specific temperature that is required. Also, we have the pass-throughs that allow us to bring some instrumentation that is required for the surgery. And also we have here the areas where we warm the blankets. As you know, the operating rooms are quite cold, so we want to make sure that the patients are warm prior to being anesthetized, and also we can control the temperature of each room individually. Another of the advances in technology that I've seen it with the design of these new operating rooms includes the integration of the PACS monitor, but also we have a system that we call integration, and that allows us to display pretty much every aspect that we want. For example, we can put the x-rays of the patient here and display in all the large monitors that you see through the room. So thank you for joining us today. So it's a pleasure to serve all the community that require our services when they need to come to the operating rooms. Thank you.
University of Iowa Healthcare. Changing medicine, changing lives.